Have you seen gaze palsy? Today we will discuss gaze palsy's recognition and step-by-step in localization. I am Dr. Neeraj. If the patient can't look to one side, most tempting diagnosis would be a 6-nerve palsy, but not always. Not all horizontal gaze deficits are nerve palsies. Many are brainstem and cortical lesions. Eye movements are controlled by a hierarchical network. The frontal eye field in the uppermost part initiate voluntary saccades. The PPRF, paramedian pontine reticular formation, is a horizontal gaze center. Medial anterior fasciculus coordinates the conjugate gaze, and cranial nerve 3, 6 and 4 execute the movement. So disruption at different levels produce distinct gaze patterns, not just weakness of a single muscle. This is network localization, not isolated nerve disease. Neuro-ophthalmology data shows that pattern recognition of gaze deficits localizes with high accuracy. So let's go step by step. Is it conjugate gaze palsy? First question. When both eyes cannot look in one direction, it is conjugate. Think PPRF or pontine lesion. Is it isolated abduction deficit? One eye cannot abduct. Then it's a local 6-nerve palsy. Is there adduction failure with contralateral nystagmus? This is the classical INO. Lesion is in the MLF. Are the eyes deviated to one side at rest? This is gaze preference. That is towards the lesion in cortical frontal lesions and away from the lesion in the pontine, if the lesion is pontine. INO is bilateral in young patients. Think demyelination, example multiple sclerosis. In older patient, it's more likely brainstem stroke. Preserved vestibulo-ocular reflex with impaired voluntary gaze is supranuclear lesion. And the fastest bedside discriminator would be perform a oculocephalic reflex or a doll's eye maneuver. If the eye moves with the head, the brainstem is intact and the lesion is supranuclear. If it is absent, it is a brainstem lesion. This single test can differentiate cortical versus brainstem pathology within seconds. So gaze palsy is not about the eye, it is about the network controlling the eye. Localize the level and the diagnosis eventually follows.